Welcome to Arab Health. It's been so good after 2 years to see face-to-face customers, partners, and talking about all the solutions and the innovations that we're having at Philips. As you know, we're about improving lives, whether it is through solutions like integrating different parts of the healthcare continuum when it comes to radiology, cardiology, but also looking at the journey of the patient. The journey of the patient might start in the critical care. And as we've seen in the pandemic, it has been a tremendous pressure on people, on caregivers, on nurses, on all the health system as well. But this type of solutions actually helps customers basically optimizing all the care they have around the ICU. And this is the type of command center that we're looking at and that we are offering to our customers. We've been having go live during this year, but also we're having a lot of opportunities talking about this type of command center, aggregating all the information and basically ultimately having the best care for the patient. But also the patient goes out of the ICU and the patient goes to the general care. And therefore we're looking at it also as a continuum of care within the hospitals. And Jalal in my team will be talking about how we transition from the ICU to general ward. Jalal?
Thank you, Dr. Samir. Actually, when the patients comes from the ICU, they move to the general ward. And in the general ward, the population, it's a heavily congested area. You need some sort of an early warning detection scoring to prioritize the patient that needs an access to care. At a glance, from the use of the Guardian, IntelliVue Guardian software, you can see that 3 patients are actually deteriorating and you can give them more priority when it comes to providing care. But as you know, the healthcare does not only happen inside the hospital, but you need mobility solutions outside the hospital.
And Dr. Samir, Tempus Pro and Tempus ALS is the solution you need for your emergency medical services, because it's a very high and advanced level of monitoring for the ambulances. It allows you to do all kinds of monitoring and do the diagnosis for your case, going from the ECG, SpO2, passing by the ultrasound and even laryngoscope. And all of this is connected to your trauma command center, where you're actually transmitting near real time all of this information, which will allow the people sitting in that command center to decide where to transfer this patient, where has the best location to provide the care needed for that patient.
Super. And this nice thing is the lightest defib on the market. It actually has no weight. It's plugged. Let me actually. This is not an AED, this is a defib, so a full-fledged defib.
Full-fledged defib that you don't find lighter on the market. And
Excellent.
This can be connected to the monitor. Whenever you need to go with the defib to your case, you attach them together and you go in one full-fledged solution.
Excellent. Thank you very much, Natalie. I hand this to you. So as you see, the patient moving from the ICU to the general ward will produce a lot of information, a lot of medical information. But we'll be using a lot of medical devices, as you've seen here, with our monitors, with all our solution, with our central station. But medical devices also might come from other vendors, not only Philips. What we can do is actually aggregating and integrating all this information through one single station. Mazen?
Yes, Dr. Samir. So Capsule is device agnostic, enterprise level medical devices integration platform that allows you the access to more than 1,000 drivers to connect medical devices all over the hospital, point of care, lab devices, anywhere in the hospital. With the integration, we are aiming to reduce medical errors by stopping the manual charting in the hospital, enabling data automation, enabling digital transformation in the hospital, which reflects on the operation efficiency and patient safety.
Which is basically what our customers are asking for.
Absolutely.
Because patient safety is at the center of what they do. Thank you very much, Mazen. As you've seen, information will come from different devices, different wards in the hospital. What we do at Philips is we connect all the dots about this patient care, whether it is through the solutions that you've just seen, but one thing that is extremely important is how we ensure that the patient experience is as smooth as possible, how the caregiver experience is as smooth as possible, how the operations are optimized in a way that actually will enable reducing cost. But all of this that you've seen can be seen through what we call a command center. All the information aggregated from these different parts, getting into one single view of the truth. So welcome to Arab Health. We are eager to see you. Please come.